Tubal ligation, informed consent in the ovarian cancer connection. This presentation is being made in conjunction with the EGEIRO Trust for the Cancer Control Society's 45th Annual Cancer Convention. It's being released September 5th, 2017. My name is Susan Bucher. I'm a member of the EGEIRO Trust, founder of the Coalition for Post-Tubal Women, a women's health right activist, nurse, author, patient advocate. My primary focus is that of women's health rights and informed consent. In this video, I'm presenting how the idea of being protected from ovarian cancer is wrongly used in the informed consent process for female sterilization. Primarily, I'm talking about tubal ligation and salpingectomy for the purpose of birth control. In 1993, the Journal of the American Medical Association published findings from a prospective study looking at tubal ligation, hysterectomy, and women's health of ovarian cancer. The study began in 1976 and followed 121,700 registered nurses over the course of 12 years. The study showed a reduced risk of ovarian cancer for women who've had a tubal ligation. Many other studies have been done looking at tubal ligation, salpingectomy, hysterectomy, and the reduction of ovarian cancer. In 2012, a meta-analysis was published in the Journal of Ovarian Research. For this analysis, the authors identified 30 studies pertaining to ovarian cancer and tubal ligation. In this analysis, the authors state in their introduction, tubal ligation may alter ovarian cancer risk by damaging the uteroovarian artery, altering hormonal function. In their discussion, they state, ovarian cancer risk may be altered by decreased blood supply to the ovary after surgery, resulting in a decrease in estrogen production. In their conclusion, they stated tubal ligation decreases the risk of ovarian cancer up to 30%. This number is huge and noteworthy. Still, other studies demonstrate these numbers to be even higher. In 2015, the findings published from a Danish study of women who underwent salpingectomy showed a reduced cancer risk of 42%. This study was the subject of a 2015 commentary by Dr. Kovacs posted at Medscape. Dr. Kovacs points out that the study found the risk for ovarian cancer reduced by 50% for those who had a tubal ligation before the age of 35. 50%. This number is even more impressive. The main theories and explanations for why tubal ligation and salpingectomy reduce the risk of ovarian cancer remain the same and are all outlined or mentioned in the studies published. 1. The process of the tubal ligation or the salpingectomy reduces the blood flow to the ovaries. 2. There's a change in hormone levels. And 3. The tubal ligation or the salpingectomy blocks the pathway of cancer agents. The selective dissemination of this information, that tubal ligation reduces women's risk of ovarian cancer, has been occurring since the 1990s. Before I give examples and case studies, it's important to define selective dissemination and its role with propaganda, ethics, and PR. As explained by Randall Marlin in his book Propaganda and the Ethics of Persuasion, public relations relies heavily on ethics, and it arises the moment we consider the possibility that the best interests of a particular institution, public or private, commercial or non-commercial, may not coincide with the best interests of the public generally. In his book, he explains that there's a code of professional standards for the practice of public relations, or PR. And one of those standards is avoiding dissemination of information known to be misleading. Defining propaganda, it is the deliberate spreading of facts and ideas. While often truthful, propaganda is often presented selectively to highlight some facts while omitting other facts. This type of propaganda is called white propaganda. As explained by Eric Brom, The most effective propaganda campaigns rely heavily on selective truth-telling, the confusion of means and ends, and the presentation of a simple, idyllic vision that glosses over uncomfortable realities. So here I present some examples and case studies. My first example of the dissemination of this information comes to you from the CDC. At their website, they have a page regarding ovarian cancer with some Q&As, and one of the questions is, can it be prevented? Their response and what they've got written is that having children, breastfeeding, taking oral contraceptives, and having a tubal ligation or a hysterectomy are all factors that decreases a woman's chance of developing ovarian cancer. They don't say why, just that these things decrease your risk. Again, here's another example again from the CDC. And they state to reduce your risk of ovarian cancer, a tubal ligation. The following example is from the National Cancer Institute, and they've got listed at both tubal ligation and salpingectomy as a factor showing evidence of a decreased risk of ovarian, fallopian tube, and peritoneal cancer. They state this, but they don't state why. Here's an example from the American Cancer Society. At their website, they state that tubal ligation and hysterectomy may reduce the chance of developing ovarian cancer. They give the warning to only have these operations done for valid medical reasons, not just for their effect on ovarian cancer risk. The American Cancer Society does take it up a notch. Shown here is a 2016 patient education brochure stating that having a tubal ligation may reduce your risk of ovarian cancer up to 2/3 or 66%. 66%. Here's another example. This is from Dr. Oz's website, and there he states that tubal ligation reduces the rates of ovarian cancer. He's conservative with the number of 34% reduction in the rate of ovarian cancer. And of course, this information is disseminated by the ACOG. The ACOG acts as the official sponsor of this information. They are considered the world's authority on women's health. ACOG guidelines and opinions are used by all members in the medical community, as well as by human rights organizations ranging from the CDC to the World Health Organization. The ACOG has a special role in the dissemination of this information. They provide the guidelines for OBGYNs in the practice of women's health care and opinions for other areas of practice. OBGYNs are the doctors who perform tubal ligations, salpingectomy, and gain financially from performing these procedures, and women's follow-up care after they've had these procedures. They are the doctors responsible for providing information and obtaining informed consent. I've written extensively on issues of informed consent. I will not go into great detail and theory about informed consent, but I do want to make some points. As explained by Russell Thornton, informed consent describes the physician's duty to disclose to the patient the risks and hazards of medical care that would influence a reasonable person's decision to give or withhold consent to that treatment. The duty to obtain a patient's consent for treatment rests on the patient's treating physician. It is the doctor performing the procedure's responsibility to give information and obtain informed consent. For tubal ligations or salpingectomy, that doctor would be an OBGYN doctor following ACOG guidelines. When a doctor fails to inform a patient, there is no informed consent. When there is lack of consent, batteries occur. The assault occurs with the crimes of omission, what is not disclosed or said to the patient. This assault, withholding information, invalidates consent. With no consent, battery occurs the moment the surgery or procedure begins. Mayhem occurs the moment a body part is altered, removed, or rendered useless. So what is the information disseminated by the ACOG regarding tubal ligation, salpingectomy, and ovarian cancer? In order to look and see and understand this, we're going to look briefly at what their PR is, their opinions, and some guidelines. PR and information meant for the public is presented by things such as brochures, websites that are intended for public lay people, and face-to-face information from doctors, and basically whatever the doctor hands them in print. I myself was told in 1994 by my MD that tubal ligation would reduce my risk of ovarian cancer, but was not told why it would do so. I even asked him directly if tubal ligation could cause a change in hormones or cause me to become menopausal. I asked this not in relation to the cancer risk, but just in general, and I was told directly no. This is what all women are told regarding hormone function after tubal ligation and female sterilizations, such as salpingectomy for the purpose of birth control. Women are told that tubal ligation and salpingectomy helps prevent from ovarian cancer, is a good way of method of birth control, and that it does not affect hormone production. I was very naive and thought the doctor had my best interests in mind, and that he was giving me all the information in order for me to make an autonomic decision to an elective procedure. I did not know that there were omissions in the verbal or printed information he provided to me. The idea that tubal ligation might provide me with better health and protect me from ovarian cancer as I grew older had a strong influence and did influence me and persuade me to have the procedure done. If I had been told the reasons why it might help protect me, or that tubal ligations are known to cause a reduction in ovarian function, I would have more carefully considered my options. Above, or here presented, is a 1996 patient education pamphlet authored by the ACOG. In the brochure it states, women who've been sterilized have a lower risk of ovarian cancer. There's omissions in this brochure, as it does not explain the reasons why women who have tubal ligation are at lower risk, or that tubal ligations can cause hormonal imbalances. These omissions continue today. When doctors and medical organizations provide information to the public that tubal ligation and salpingectomy reduce the risk of ovarian cancer, they also need to include the reasons why. Otherwise, it becomes dissemination of omissions and misinformation. In January 2015, the ACOG made public their committee opinion promoting salpingectomy for ovarian cancer prevention. In their opinion, the ACOG suggests that salpingectomy should be a new standard of care to prevent ovarian cancer, and that it should be used in place of tubal ligation for sterilization. So going more in detail with their opinion, within they make the statement that when counseling women about sterilization methods, that practitioners should communicate that bilateral salpingectomy could be considered a method that provides effective contraceptive, and also to basically promote the idea that it would help protect her from ovarian cancer as well. This is a document that lay people normally don't see, and deep within this document, just a sentence saying care should be taken not to interrupt the blood supply to the ovary. So the ACOG mentions this to their doctors, but they don't direct their members to inform the patients regarding this risk, just to promote that it will help protect them from ovarian cancer. In their practice bulletin, Benefits and Risks of Sterilization, this is a document meant for the doctors to read, not really for lay people. They make the recommendation to inform women and their patients that tubal occlusion reduces the incidence of ovarian cancer. They don't make the recommendation to inform the patient on the reasons why. They do mention salpingectomy, that it may adversely affect ovarian function, but the way they have it worded is they kind of downplay the risk, saying that there's some concern it may adversely affect, but they make the reference that it may not, like it's really not important. And this information is buried deep within the document that I don't know if doctors and the members read through this document completely. I think they just look at the recommendations. They also have a committee opinion on ethics for the sterilization of women, ethical issues and considerations, and they make recommendations as well. In their recommendations, with their ethics opinion, they make the statement that forced sterilization practices are unethical and should never be performed. I don't know if OBGYNs sit and actually think and ponder if withholding information from a woman is a type of force, but it is. It's a type of force when you withhold information in order to persuade someone to make a decision that you want them to make. In their counseling content in this ethics document, they're very specific, and they tell their members that OBGYNs have an ethical duty to ensure that patients understand the risks and benefits, and specifically the idea that the procedure could reduce their risk of cancer. They specifically have that stated in this document in this manner. So what about the World Health Organization? The World Health Organization has a document and works to eliminate forced and involuntary sterilization. They work with a number of other organizations, but even the World Health Organization looked to the ACOG for advice and information and guidance on ethics and safe methods of sterilization, and what to inform women of and what to expect after sterilization. So the World Health Organization states that sterilization without free and informed consent is a violation of fundamental human rights. And they further state that forced sterilization is a violation of the right to be free from torture and other cruel, inhumane, or degrading treatment or punishment. Forced sterilization of women is also a form of discrimination and violence against women, and any form of involuntary or forced sterilization violates ethic principles. Within this document, the World Health Organization has the following information printed. This box 1 is kind of directed towards practitioners, stating that the information should be provided to people so that they can make an informed choice about their sterilization procedures, and that they should emphasize the risks and benefits and explain the side effects. And that the counseling on sterilization should also include the following points. One of the points being that there are potential side effects of the sterilization procedure, and follow-up care will be provided. And then they have the statement, details should be provided. In this document, they don't give details. They don't really direct what details. It's rather vague, and even this document seems to be a type of white propaganda where some truths are being told, but other things are being admitted. In the meanwhile, the ACOG promotes sterilization as protection against ovarian cancer, but does not provide guidelines to disclosing the risks of a hormonal imbalance or ovarian failure after tubal ligation or salpingectomy. So as a reminder of the risks are that it can create a hormonal imbalance. And the worst case scenario is castration, losing complete ovarian function. And so my question is the risk of losing complete ovarian function worth the benefits of being protected against ovarian cancer? Just to be clear and to have an understanding, if in the process of the tubal ligation or salpingectomy, complete ovarian failure occurs, it is the same as bilateral oophorectomy or removing the ovaries. This causes an early menopause, also known as female castration, and hormone shock occurs. Early menopause, caused by bilateral oophorectomy, castration, or removal of the ovaries, or ovarian isolation, which is known as a side effect of tubal ligation and the salpingectomy. It's known to shorten a woman's lifespan overall because of a higher incidence of stroke, heart attack, bone loss, and other health issues later in life. Shown here are photos of my ovaries at the time of my tubal ligation and 3 years later. Visually, you can see how my ovaries became atrophic from the ligation process. In my case, the blood supply to both my ovaries were affected, and I suffered a surgical menopause, also known as castration. Not all women will lose function of both ovaries. Some women will have no loss, and some may lose function of just one ovary, in which case alone would reduce her risk of ovarian cancer by 50%. For me, the condition of suffering a castration and the health outcomes associated with being menopausal decades earlier than normal, and the health outcomes such as bone loss and increased risk of heart disease and facing an earlier death, far outweigh the benefits of being protected against ovarian cancer. The following is a copy of labs that were drawn for me a little more than 2 years after my tubal ligation. The labs show that my FSH was almost 92, my LH was almost 27. I was definitely in a menopausal state. At the time, I was 36 years old. And the purpose of me presenting this information in context of this presentation is not that it has to do specifically with ovarian cancer, but the fact that the tubal ligations and salpingectomies can cause ovarian function to be reduced and can cause early menopause and castration. But women aren't given the opportunity, they're not told that this is a risk, and they're not offered hormone testing before these procedures. This is another issue of informed consent that goes along. Everything's kind of intertwined, but women should be allowed to have hormone testing before any type of reproductive surgery, before any tubal ligation, salpingectomy, before a hysterectomy, before an exploratory surgery. They should be allowed to have hormone testing so they have a baseline to go by in case there is a change of their ovarian function and their hormone levels. They have a baseline to go by. So what are the laws? What are the laws in the United States? Each state has different laws on books regarding sterilization and the process of informed consent. And I'm just grabbed two snippets here. One's from Michigan. And in Michigan, in their documentation and their law, it says, give a full description of the discomforts and risks that may accompany or follow the performing of the procedure. And so this could be kind of read in two ways. You might look at this as a layperson and say, oh, I'm going to be told of the risks of the procedure. And I think what they're saying is the risks of the actual surgery itself. They're not saying what the late sequel is or what's going to happen 2 weeks later when ovarian function starts to decrease. They're stating regarding specifically about the procedure itself. And then it says, give a full description of the benefits or advantages that may be expected as a result of the sterilization. So they're told to give a full description of the benefits and advantages, but they don't say anything about giving a full description of any risks or side effects, which is kind of interesting to note how things are worded. In Colorado, they state information concerning the surgical procedure and risks involves complications and failures. So they're basically saying, tell the patient how many women may go on to become pregnant, maybe complications of the surgery itself, but not of what an expected side effect of the surgery could be, which an expected side effect is your ovarian function could be reduced. So that's two examples. The third example I want to give is Texas. So what about Texas? Texas has the most specific outline regarding sterilization. So I want to take you through Texas. Texas Health and Human Services Commission has a policy manual titled Healthy Texas Women, which is very specific in detailing what needs to be informed to women when they're going for a tubal ligation or a female sterilization. So in Texas, they have what's called the Texas Medical Disclosure Panel. And this was a panel established by the Texas legislature to determine which risks and hazards related to medical care or treatment or procedures had to be disclosed by healthcare providers or physicians to their patients in order to authorize consent. So this has to do with informed consent. So what they did is they developed two lists. One's an A list and one's a B list. And things that are on the A list require full and specific disclosure. Items that are on the B list do not require full and specific disclosure. Tubal ligation and vasectomy are both on the A list. So what does this mean? This means that what's required disclosures for tubal sterilization include injury to the bowel and or the bladder, that you'll become sterile, that you will no longer be fertile, that there's the risk of there's the risk of not becoming sterile and you still may go on to have children. And then there's the risk of the loss of ovarian functions or hormone production from ovaries. So, these disclosures are not printed on the informed consent, but they're left to the contractors, which are OBGYNs, who perform the procedures to disclose to the woman. And this creates a conflict for these doctors who are governed by and operate under a code of silence directed by the ACOG. And I can guarantee you that women in Texas are not informed of the risks of losing ovarian function. Women in Texas are not informed of post-sterilization syndrome, post-tubal ligation syndrome, post-implant syndrome, and in some cases, women aren't even being informed that devices are being implanted within them. I've talked to many women, and there's many abuses going on. Texas, I think, has the most specific disclosures and state law in the nation, and these laws are not being followed. Women are not being informed that there's a risk of loss of ovarian function after tubal sterilization. So, working with the EGEIRO Trust and the Coalition for Post-Tubal Women, we're looking for justice and fairness and truth. Our goal is to help protect women and the public from untruths and bad outcomes. And to leave you with a thought here, I just want to play a news segment that was recently played regarding ovarian cancer. And I would greatly appreciate feedback on your thoughts on this topic and issue.
One of the deadliest cancers.
Ovarian cancer is often diagnosed in the late stages, but new research actually shows that surgery can prevent most lethal form of ovarian cancer. Our health reporter Bianca Castro joins us in studio now with more. Bianca?
Yeah, so doctors say there really isn't a good screening test for ovarian cancer, and it kills 14,000 women in the U.S. every year. And that's why some doctors are following the latest research and removing the fallopian tubes of women concerned about getting the cancer.
Sarah McClellan Brandt fears the idea of ovarian cancer.
I had an ovarian cyst when I was a little girl, and it just, there's no official link, but it just still kind of scares me.
Good morning.
Good morning.
So she's considering an option Dr. Darren Tate now offers his patients: complete removal of her fallopian tubes, the two thin tubes that connect the ovaries to the uterus.
That 60% of all ovarian cancer of the most deadly type, the serous type, come from the fingers of the tube. It's advisable to take them out when we're removing the uterus itself.
As he mentioned, the procedure is for women already undergoing a hysterectomy, or, like in Sarah's case, a tubal ligation, getting her tubes tied. It might also be an option for women with the BRCA1 gene, a gene mutation that increases the risk of cancer.
If all those patients had their tubes removed, they've estimated that it could cut down on ovarian cancer deaths by 40%.
A promising statistic, says Sarah, if she decides she's done having children.
If we do make that decision, this will probably be the way we go.
So studies and trials are still underway to see whether this is, in fact, a proven method to prevent certain ovarian cancers. Dr. Tate says that you should talk with your doctor to see if this is an option for you. Chris?
Thank you, Bianca. Now to an urgent health